Okay, another area that's really common to treat with Botox, I'm going to have you flex your nose muscles. And these bunny lines, we call them, are caused by a muscle that's pulling things up. And, when that happens, you get lines that go perpendicular to the way the muscle is moving. So flex them again, you'll see the lines are going the other way. So when we inject Botox in that area, that helps to soften those lines. Another common area, I'm going to have you stick your lips out like this. When you do this, you get some of these lines. And for people who have those kind of smoker's lines, we call them, very prominently, they can do a little bit of Botox in the upper lip to soften that appearance. Another way to treat that area without weakening the muscle could be to inject some filler to strengthen the skin so that it doesn't crease as well in that area. Now, I want you to flex your chin. Can you do that? So she's trying. It's more something that you notice when you're talking, and I notice it when people talk, and I'm trained to look for it. And so I'll have them just tell me a little story, and when they do that, they pull the chin muscle up. And you can see she's got a really subtle crease, and she's also got this orange peel effect. So a little bit of Botox here and here can kind of help to soften those muscles and that orange peel and that chin crease. That's a really good thing to treat. People also will treat Botox in the lower face for these muscles called the depressor angulate oris. So it causes the corner of your mouth to come down, and when you treat Botox here and here, and you can even carry it farther down here and here under the chin, the injection sites will help for the corners of the mouth to come up, and it'll even improve some jowling that you have. It's good for subtle jowling. If you really need a facelift, you need a facelift, and Botox is not going to be the cure for that. People that have these really prominent platysma bands under there, you can inject some Botox in a few places along this muscle, and that helps to soften that. And you can even inject under the chin to those muscles, and sometimes people have some muscle action that's causing some of the skin to look like it's hanging. If it truly is skin that's hanging, then a skin tightening treatment or even a neck lift might be the way to go. So those are some uses for kind of the lower half of the face, or more unconventional, so to speak, uses of Botox. One last thing I wanted to touch on is if your face happens to be wide in this area, or if you have a strong muscle and that's jaw clenching, you can inject some Botox into the masseter muscle. That will help to reduce that muscle temporarily while Botox is taking effect, and it'll also reduce your clenching and the tension that you get. Some people grind their teeth, their dentists complain, their teeth get replaced, and a little bit of Botox can be really preventative and helpful for that issue. So those are some things that I think are less apparent, less obvious for Botox to address, but very effective.